So we'll start off by going over the quiz case from the prior video, and I'll just quickly go through this exam, and I'll bring your attention to the findings of interest here, and that is this asymmetric bilateral hippocampal and mesial temporal lobe atrophy over here and over here. And there's an accompanying PET-CT exam using FDG, which is a radio-labeled glucose analog, and we use that to measure the metabolism of the brain. And so the finding here is decreased activity, indicating hypometabolism in the parietal lobes bilaterally. And these findings can be seen with Alzheimer's disease. So good for you if you're able to get that. We'll move on to our cases, and we'll be covering acute appendicitis today. So our findings are in the right lower quadrant, but this is the first exam, and we'll just go through the entire abdomen quickly. Okay. And so to find the appendix, we're going to look for the cecum. And so here's the ascending colon, and we're going inferiorly towards the cecum. And here we have the ileocecal valve and the terminal ileum. And more inferiorly along the cecum, we're going to find a blind ending pouch, which is right here. And there's the blind end, and that is the appendix. And so here we can see that it's not really dilated, but the margins of the appendix are a little fuzzy. There is maybe a little bit of hyperenhancement of the mucosal walls, and there is some hyperemia associated with the appendix. We can see that these vessels surrounding the appendix are just a little more prominent than elsewhere in the abdomen. For example, in this loop of small bowel, this is normal bowel vasculature, and this over here is a little bit increased. So this is a case of acute appendicitis, and this is a mild case. We'll move on to another case here, and again, here we are at the cecum, and again, here is our blind ending pouch. This is the appendix, and here we can see a small bright spot or hyperdensity, and this is an appendicolith or an appendiceal stone, and we can see that proximal to the stone, or up here towards the base, the appendix is normal in appearance. Distally to the stone, we can see that the appendix is slightly distended, and again, there is some periappendiceal hyperemia, congestion, fatty stranding, however you want to call it. There's some haziness of this fat surrounding the appendix. This is normal fat, and this is abnormal fat with some inflammatory changes. So this is another case of acute mild appendicitis. We'll move on to another case here, and again, we have the cecum over here, and we have this blind ending tube filled with gas. And this is distended, and there is significant associated inflammatory changes, so this is another case of acute appendicitis. One more case here. Well, this is the last CT case, and you'd have to follow it a little bit more, but you're going to have to believe me when I say that this is the appendix, the base of the appendix over here, and you can follow it along and see a blind ending pouch. So this is the appendix, and we can see pretty large appendicoliths or appendiceal stones, and distally the appendix is distended, the wall is thickened, and we have some periappendiceal inflammatory change. It's a little hard to see here because of crowding of adjacent structures, but there's some haziness of the surrounding fat. So this is another acute appendicitis. Now, this is what acute appendicitis looks like on ultrasound, and this is typically the modality of choice, especially in pediatrics. And so again, we have our blind ending tube here. This is our appendix, and we see that the surrounding appendiceal fat is slightly hyperechoic or bright compared to other fat within the field of view. When we put Doppler on, we can see that there is some hypervascularity. And when we take a measurement, it turns out to be 1.2 centimeters, which is distended or dilated. The normal measurement is typically 6 millimeter. So this is an ultrasound case of acute appendicitis. And something else you can do on ultrasound is you can compress the tissue overlying the appendix with the ultrasound probe. And if this is inflamed and under pressure, typical of acute appendicitis, the appendix typically will not compress. So those are our cases for today. Now we'll move on to our quiz cases. So I have a series of radiographs here, and they're different patients, they're different pathologies, but they all share one sign in common. So I'll leave this on for a few more seconds. And the second radiograph, again, there is one sign in common that these three radiographs share. And the last radiograph, so these all share one common sign. If you know the answer, then leave it in the comments below. We'll move on to our second case. This is a 42-year-old female with paresthesias. And so here we have our cervical spine MRI sagittal and axial planes below. And we have a T2 where the CSF is bright and T1 where the CSF is dark. So let me know what the findings are, and if you know the answer or the diagnosis, leave it in the comments below. That's the end of this video. If you liked it, then give a thumbs up, and if you want to see more, then subscribe to the channel. Thank you.